Now we get to look at um, another syndrome, and this is what is known as the Milwaukee syndrome. I think I should actually get a pen like this. This is better. I don't know why it's not working that much again. Okay, so this is Milwaukee shoulder syndrome. So what is the Milwaukee shoulder syndrome? Let's quickly look at it. Okay. Of course, when it occurs, it destroys your shoulder. Okay, it destroys your shoulder. All right. So it's a rare destructive crystal-induced arthropathy. Okay. So it's seen in elderly women characterized by a rapid shoulder destruction. Okay. And your rotator cuff is tearing off. So it typically presents with what pain, swelling, and restricted motion. Okay. And there's large hemorrhagic effusions. So key features of the Milwaukee shoulder syndrome is what? Demographics mostly affects elderly women. Okay. Um, Most commonly, they have osteopenia, or you could say osteoporosis alongside it. So pathogenesis is associated with what? Deposition of basic calcium phosphate crystals, known as the hydroxyapatite. So those crystals are the ones that are triggering what? Enzymatic activities. So a lot of collagenases, a lot of proteases, okay, leads to cartilage and bone destruction. Okay. So clinical presentation is what? A lot of pain in the shoulder with acute exacerbation. So large and often blood stained joint effusions, severe restrictions of movement, and frequently bilateral involvement, like your two shoulders are involved, or sometimes can go to your knees and also your hips. So imaging findings. When you do an imaging for the Milwaukee shoulder syndrome, what are you possibly to see? Okay, you see things like destruction of the humeral head and the glenoid. Okay, and okay, joint space narrowing and what high riding humeral head due to rotator cuff tears. So the CT scans and the MRI confirms extensive bone loss and also rotator cuff pathology. Ultrasound will demonstrate effusion and cuff tear, but it's less specific. The synovial fluid analysis, you see hemorrhagic fluid with what hydroxyapatite crystals, and cultures typically is negative, okay, and helping to differentiate from septic arthritis, okay. So management is conservative treatment, like you use analgesics to reduce the pain, you know, intra-articular corticosteroid injections in selected cases, physiotherapy, surgical options. They do shoulder arthroplasty where they basically try to replace, you know, the shoulder joint. Okay, so this is what we got. Okay, so this is a summary of what the Milwaukee syndrome is. You know, so clinical importance is usually misdiagnosed. Some people can say it is septic arthritis, some people could say it's osteoarthritis. But the hallmark is rapid joint destruction. You know, so awareness is crucial and is rare. Okay, but mostly affects elderly women. Okay, you can see how the shoulder here is destroyed to a large extent. Shoulder is destroyed to a large extent.